Feature tonight, we look into chiropractic, which is a healthy lifestyle, a way of making a conscious effort to work towards a healthy living and wellness. It helps in keeping the body on optimum function to correct existing problems that includes a healthy diet, a regular exercise, and other positive lifestyle. Our reporter Sazamunga has more.
Chiropractic to many may seem like a healthy lifestyle, about making cautious effort to work towards healthy living. But what many do not know is that chiropractic is necessary to every human being as it corrects the wrong in our body.
Chiro means done by hand. Chiropractic, it's just done by hand. If we define chiropractic, we can define chiropractic into three branches. Chiropractic is a science, chiropractic is a philosophy, and chiropractic is an art. So let's look at a philosophy. Philosophy is the belief system. There is a belief system in chiropractic that illnesses or disease starts or stems out from the central nervous system. It's a science because there has been a lot of research that has been done to justify or quantify why chiropractic works. In fact, chiropractic is so popular and with great results that it's the second largest healing profession in the Western world. 3, it's an art. It's an art because you have to know or how you have to be trained to look for what we call vertebral, which is bones, subluxation. The subluxations can be in the spine, meaning from the head, the spinal column, from here to here, or it can be on the limbs, either the hands or the lower limbs.
The first visit to the chiropractor begins with body checkup to get the body misalignments.
This machine checks on your weight distribution. So that is to check whether you're bearing more weight on one side or the other side. Again, also checks whether you're also leaning on the heels or on the forefoot, or the weight is well distributed. So whenever you bear more weight on one side, like for him on the left side, so this is the compensation pattern all the way to the right shoulder. So the foot arch usually drops, the knee rotates inwards, the pelvis or the hip drops again, the pelvis tilts, and the opposite shoulder drops to compensate for this posture. So you might be having pain on the left ankle, left knee, hip, lower back, and shoulder, especially on the right side. So that's why you get some people having pain, and there's no trauma at all.
Once tests are done and a problem is detected or misalignment is detected, then a patient is brought into the alignment room where the process of alignment begins.
So in chiropractic, we like to look at leg length. Okay, so if you look at here and you look all the way up, see when I push there and I push here, and you look at all the way up, you can see it's like there's a shift slightly to this side. This bum is higher than this bum. Yeah. You can see that. Okay, and this is the right hand. And then when you look here, this is shorter. Okay, but let's see if it's true. When I put here, you see, don't know if you can see, this cannot go beyond here, this can go further. This one is locked. Okay. So, and then when you look here, this is bigger compared to this. You can see, this is bigger. So we want to check the mobility here.
According to Dr. Hamisi, fear is also a cause of body stiffness, and during this COVID era, he says he receives numerous recovering COVID patients.
People went home, and when people went home, they started working on not the proper furniture that they have in the office. Some started working from the bed, others on the table, others on the floor, assuming very bad postures and for a very long time. So these patients are experiencing what? A lot of muscle stiffness and a lot of muscle pain. So they need to come in and get their body realigned. Na wapi unasikia hapo? Ndio? Si uchungu. Although kuna ka pin prick lakini si uchungu. Usiogope. pinprick.
With a large population suffering from muscle and backaches, but as Dr. Hamisi advises, chiropractic should be an option. Reporting for Switch TV, my name is Saza Munga.